This conference will now be recorded.
Hello, good morning. This is Dr. Aisha. I'm just going to give you some information on MRCOG Part 2 examination. Most of this information is for those people who just keep sending me messages, me and my team, and they want to know that how we can pass this exam. So as we all know that Part 2 MRCOG is quite a challenging exam. It's a very prestigious qualification, and as you know, if the things are difficult and they carry some value, then it's not easy to obtain them. But anyway, there are methods and there are ways by following them we can reach somewhere. So when you start working on the part 2, then you know that college has changed some requirements. In the past, you were required to do part 1 MRCOG, then complete a 4-year training period, and then you were considered eligible to take exam. But this has been changed in 2019, and now immediately after passing part 1 MRCOG, you can proceed to MRCOG 2, and then after fulfilling a requirement of 4 years training in the discipline of OB/GYN, or if you are working in UK or you are registered with GMC already, then under certain conditions you can be allowed to take MRCOG 2 exam. So as you know, this exam is held twice a year, and syllabus and guidelines, many things have been changed in the last year. So I'm just going to update you about the changes and then how you can change your preparation according to the new requirements. So this exam is held twice a year, and you know about the exam format. So we'll talk about them. So before starting anything, you should know that what you are getting yourself into and how you are going to get out of that. So regarding part 2, you should be clear that why you are trying to take this exam. So there are certain questions, what you will get out of it, how you can get it, and then what is the benefit. So you are the best person to say, to decide that why do you want to take this exam? What is on your agenda? Like how you will prepare. So many things are important. Like for any exam, first you should know that when do you want to take the exam? What is the most suitable time for you? Then the plan is that how to prepare for the exam. Then what is your plan? Okay. Then what should be your approach? Then how you are going to gather information, how you are going to organize it, and then do you have enough time? You need to make a schedule and then you need to stick to that. Your schedule should be realistic. You should not overstretch yourself as most of you are working. So you need to be very realistic and then you should make a timetable. It is wonderful to have a study buddy, but because they are very important for sport, and when you discuss some points with someone, they are more likely to stay in your memory. So it is better to have a study buddy, and it is better that if they are from the same place or at least they are working in the same discipline, because you can understand what the other person is telling you. So, and then when you can share information, and you should work in small group. Like there should be 2 persons, 3, or at the most 4 persons, not more than that. And whenever you are sharing information with each other, you should ask each other that what is the source of information, what is the evidence. Because here in this exam, this is if you will go to the RCOG website, it says that this is the exam of the OB/GYN practice in the UK. So it doesn't matter that what we like and what we don't like. So we have to stick to the requirements of the college. That's why it is important. Then many people they will tell you that recalls are very important. For the recalls, you should know that you will get some useful information that what is the idea of the question and what type of questions are asked. But but you should not stick to them because recalls are not everything. You should understand that those topics are very important, on which the questions are based, and if you will take these topics out, then nothing will be left behind in the OB/GYN, so they won't be able to question you on several things. So don't put unnecessary stress on the big girls. Don't rely on them. Then, as you know, that you will have two papers, part one and paper one and paper two, and duration of each paper is going to be like 3 hours. You are going to get 50 SPAs and then 50 EMQs. In paper one, then you will have a break for 1 hour, and then again you are going to sit for the second paper. Again, the duration is going to be 3 hours, and you are going to answer 50 SPAs and 50 EMQs. So this exam is very tiring. You will feel tired, and it's very important for you to plan ahead that how you are going to behave during exam. Don't try to read anything during exam or the day before the exam. I will tell you later why you should not be doing it. So if we start about the starting point, then the best source of information is going to be RCOG website. You should, once you have registered yourself, you should register actually once you have gone through the full syllabus. Don't take premature attempt. I have seen people getting frustrated, leaving everything in the middle because now they think that since they have failed like once or twice, then they think that they can't take things anymore and they quit. So avoid to have a premature attempt. It is understandable that everyone is stressed out and you would like to go and just pass the exam. But there is a way of doing things. So you like to do the things in the right way. So that is the starting point. Okay, then we'll first see that what the college people they expect you to know about. So if I have taken these screenshots from the college website so that you should be sure that this information is authentic and this is not what I want. This is what the college wants you to do. Green Top guidelines, they are the most important source of information for you. Then NICE guidelines, and then consent advice, scientific impact papers, good practice guidelines. Then college has its own journal, the obstetrician and the gynecologist. You need to do for the last 3 years. BGOG, mostly in BJ, British Journal of OB/GYN. Mostly the studies are published here, but these studies are highly credible. So you should have at least the basic information there. What exactly we have it, why they are giving us this information like that. Then research is a big part of your exam. Research, you should know about the research methodology and how you can improve clinical governance. That's very important for you. As you must have noticed in the shift in the exam, now the RCOG is putting more emphasis on the non-technical skills. Non-technical skills mean that how you are going to behave with people, how you are going to behave at the workplace, and how you should communicate, how you should carry yourself through the system. So all of these information is very important. So the starting point would be that first you should pay visit to the RCG website and see that what information is given there. Strategy is a very important source of information. So first you should know that what exactly is there, how you are going to prepare. Then the point is that I have seen many coaches and many other resources where people are just blindly following everything. Still, I can see on the websites they have written that we are working we are covering all 18 modules and like stuff like that. So this is not the case. The college has changed many things. So whenever you start working on any exam, just go to the relevant college and see that what changes they have made. So in July 2019, RCUG made certain changes. Instead of calling them the modules, the whole syllabus it has been divided into capabilities and practice. It is divided by the RCOG. So CIPs means that clinical competence is in place, and they have certain expectations. Like they want that doctors they should display certain capabilities. Like if I will read for you, that you should be able to apply your medical knowledge, clinical skills, professional values for the provision of high quality and safe patient-centered care. Then the second competency is that should be able to work successfully within health organizations. It is that how the NHS works. Then the third competency is that doctor has vision, engages, and delivers the results. So result-oriented practice. Then the doctor should be design and implement quality improvement projects or interventions. This is what I told you that non-technical skills, they are getting more and more information. The next competency is also related to understanding of the basic human factors, principles, and practices at individual, team organizations, and system levels. You should know, like when you are working as a specialist, then you are working as a captain of the ship. So you should know exactly what resources you have and then how you are going to deploy them to get the maximum benefit. Then you should take active role in improving yourself, helping yourself and the others. And then you have to engage with the research and you have to promote innovation, ideas, grants, everything is there. And then you should act as a teacher and you are going to work as a health professional also. Ninth competency is that is specific to the OB/GYN. So eight competencies are general and then rest of the competencies they are specific. Like you should be competent in recognizing, assessing, and managing emergencies in gynecology and early pregnancy. This is a very important area, and the people who are preparing for the exam, they think that they are just supposed to deal with the obstetric emergencies. This is not the case. Gynae is equally important. Then the 10th competency is that you should be good in recognizing, assessing, and managing obstetric emergencies. 11th competency is that you should be competent in recognizing, assessing, and managing non-emergency gynecology and early pregnancy care, like the routine care, simple things, and the simple solutions. Then you should be clear about non-emergency conditions in the OB care. And then the third part of the competencies is that you should have your own professional identity. Like when you are working in this discipline, your motto is that you are going to improve the global health of women. Okay? You're not going to confine yourself to the UK system only. Like here, you have to work with all groups and within society. And then the 14th competency is that you are able to take an active role in implementing public health priorities for women and work within local, national, international structures to promote health and prevent disease. So apparently it seems difficult, but this is not the case. Okay. So you should remember that just by doing the green top guidelines, nice, and the talks, you're not going to pass the exam because a lot of emphasis is placed on the non-technical skills also. Then RCUG has given a grade, and as you can see that there is a shift, like this grade is helpful for all parts of the MRCOG. And like for MRCOG1, this color is green. And for you guys, for the MRCOG2 people, this is shown in mustard. So as you can see that the clinical skill is very important for you guys, then clinical research. So these are the second competencies. Then you can see that post-surgical skill, post-operative care is there, antenatal care and maternal medicine, then management of labor, management of delivery, and postpartum problems. Here, most of the people, they are giving all of these three modules in one heading, but you should know that all of these are distinct. Of course, there are some merging areas, but these are three different modules, and you are going to get a lot of questions from here. People think that their RCG is asking questions only about delivery. This is not the case. You need to know about the normal labor, abnormal labor, complications of the delivery and their solutions, and then what can happen to the mother and what can happen to the baby in the postpartum period. I will tell you in detail after a while. Then by writing just one word here, like gynecological problems, as you know, there are so many problems. General gynecology, I think this is the lengthiest module of the gynecology. Subfertility is very important, though it is considered subspecialty. But even at MRCG2 level, you are expected to know a lot about it. You should know about the sexual and the reproductive health, then the early pregnancy care, then gynecological oncology, and then urogynecology and the pelvic floor problems. So a lot of questions are there. Then from each module, the college expects that you people should be able to answer the questions. Yeah, you can, but the point is that what exactly they expect from you. So it is not something small that like you will just sit somewhere and you will do. This is not the case. Okay, so you should know about them. So I'll just tell you about them. So if
Assalamualaikum.
you like Sam, yeah, how are you?
Fine, Alhamdulillah.
That's
Sorry,
great.
just I was saying Asr prayer.
That's okay. No problem. No problem at all. That's absolutely fine. So as you know, like we started before, but then we stopped because of Ramzan because everyone was not responding in a good way. So that's why, we suspended the classes, but now we are going to start at full pace. So we should be able to cover everything. Okay. So when we are talking about part two exam, then we need to understand the examples, that what exactly they are expecting from you. So the first step is to understand that what is this exam all about and what is expected from you in the MRCD part two exam. So the college writes that you should have the competencies of ST5 according to the RCOG curriculum. So we'll go over this. In the curriculum, they have included many things like the modules I have just told you. Then basically they say that what is the purpose of taking part two exam. So the part two exam, it assesses the knowledge required for clinical practice. So it is going to examine the 15 core knowledge areas and then 4 domains of understanding. Like what are those 4 domains? These domains are important for patient safety and practice of your discipline. Diagnosis. So it means that you should be able to give and consider important differential diagnosis and the features of different OB/GYN conditions which you are going to see in your practice. Then investigations. You should know that which investigations can be used for diagnosis, monitoring, and prognosis. Then you know that one investigation is not going to answer all of these questions, right? So you should know about them. But the main emphasis will be on management. So part two people, they should be very good in when it comes to management of different conditions. So it means that you should know about medical, surgical, non-medical management, as well as you should know about other clinical and non-clinical practitioners. When are you going to involve the hematologist? When are you going to call the hematologist? When should the surgeon be called? All of these things, these are part of management. It is not like your simple observation that simple management that someone has obstetric cholestasis, so I will just go and treat her with, I will give her a psoriatic acid and she's going to be fine. No, you should know that obstetric cholestasis is a diagnosis of exclusion. And do you need a second opinion? Are you going to refer her to the hepatologist or she's going to the dermatologist or what? At what stage? What complications you can have? Your patient can have? What complications her baby can have? Are you going to deliver them prematurely? If so, then what is the role of neonatologist? Do we need to call him? So everything that how you are going to work within your discipline and how you are going to make an interdisciplinary team. So these things are important. And fourth expectation is that you should be good and you should know about the epidemiology. It means you should know about the incidences, progression of disease, natural history of different clinical disorders, prognosis, efficacy, patient-centered care. So you should know that what actually can occur to your patient in the acute phase, then what can occur in the long term. So what will be the prognosis? So you're going to make an overall plan of care of your patient, like that. So then you should know that how they are going to assess your capabilities. So the exam is going to use both single best answers and extended matching questions. And as you know, the SPA questions and the EMQ questions, their topics, they can overlap. However, SPAs, they are particularly useful in the assessment of etiology, natural history of disease, epidemiology, and statistics. Now, why do they ask EMQs? EMQs are very useful in the assessment of diagnosis, investigation, and management. So mostly in the EMQs, you will have to answer questions which are related to diagnosis, investigations, and management. Main bulk of the EMQs will be on the management options. So that is why it is very important. And you're going to cover everything which they expect in each module. So apparently it seems difficult, but as such it is not. Once you will start working on that, then you will see that things are fine and they are not as difficult as we expect. Okay, so let's start. Like when you are starting that course, you are starting to prepare for anything, then you should know that you have to take calculated risk. Like you cannot say that what I should do. Like you know, you cannot just gamble. Just need to be very careful. You need to see that what exactly that you are expected, and that do you need to take any professional course. Like for the Ariz MRCOG course, I know that people who have taken it, their success rate is like 90 to 95% in the first attempt. Why? Because we are all of your mentors, they have the work experience, they have been working in the system, and they are qualified, they have the degrees like that. So you have to stay positive, you have to find hope like that. You can join this course, you can join other courses. So just don't give up. See that how you can get help and how it is going to you can be successful. Regarding in the modules, and first step in solving any problem is that you should tell someone about the problem, okay? That why it is important. So never think that if you will ask someone, then others will get this impression that you cannot do something on your own. Well, once you all are practicing somewhere, then you should know that it's not bad. You have to find hope, you have to stay positive. It is a long process. It's going to take at least 6 months, and then you have to maintain a balance between work and the family life. Okay, like that. So don't give up. Just make a good plan. So like the first knowledge area is teaching. So let's see that what exactly do they expect from here, from you guys. Like for you in the first module, it is important for you to understand important elements in OB/GYN history. Sometimes you will get very simple question that what exactly will you ask them about the history. Then you should know the principles of and the legal issues around consent. What are the rights of mother? What are the rights of unborn baby? Postpartum examination. Then how to take consent for the surgical procedures. Especially special area is going to be sterilization and provision of contraception. Then where do you need parental consent? And what are the Fraser guidelines? What are the medical certifications? Then many people, they will try to confuse you that what is Gillick's competence, what is the Fraser guidelines. But if you will go to the RCOG, you will find that they are essentially the same thing. Okay, so don't have to do anything. Lord Fraser is the one who was the MP and he passed out this ruling, and Gillick was the woman whose whose girl was given this contraception without knowledge of the mother. Okay? That is the point. So you should know about that thing, that what is the implication of consent, who can consent, nobody can consent except the patient, then how you will take consent from the minors. So these are practical issues which you are going to see. So that is your first knowledge area, and actually this area is explored very heavily. You should know about the laws, what are the surrogates, what are the communicable disease notification, do you understand the sources of the medical legal information, mental health legislation, a lot of stuff is there, and then how the college has put everything into the guidelines. So actually, very lengthy, this problem, this module, but we have taken up everything. And when you will come for the course, then you are going to get this whole list of the topics, because in this module, many topics are covered here about your vocal, verbal, non-verbal communication, how you should talk to the parents, and which form should be filled. So everything is there. If you will go to that RCUG website, you will find that so many things are there. And then the second knowledge area is teaching and research. So what are you required to know about this model? You should know about quality improvement and management. Then what are the clinical standards, guideline, and the protocols, how they are made. Sometimes they will ask you that what is the highest level of evidence? Is that meta-analysis or a systematic review? And these questions are asked basically in the EMQ, so you should have a very clear concept. What is a systematic review and what is the randomized clinical trial? What is the meta-analysis? Meta-analysis, is that superior to a systematic review, or systematic review is superior to meta-analysis? So you should know that systematic reviews, they are just raw material, and then on the basis of the specific systematic reviews, we are going to make a meta-analysis where we are going to get many studies, and then we are going to find the answer. And if we want to have a good meta-analysis, there should be robust systematic reviews. These things seem difficult for us because we are not practicing with such things. But once you have a good concept, you can do everything. Then you should know that what are the principles of risk management and what is their relationship to the clinical governance and complaints procedures. You should be very clear that risk management and quality improvement, these are for patient safety. And in any healthcare system, patient safety is never compromised. So the purpose of all of these, risk management committees, RCAs, purpose is not to punish anyone. Purpose is to improve quality of care, quality of life, and provision of the best care. This is not a plan to punish someone. Okay? So then you should know that can you analyze, can you appraise any scientific trials, literature. These are easy marks. There are just a few types of studies. You should be well versed with them. What is a clinical trial? How many different forms it can take? So what sort of, then they will give you case scenarios, and they will ask you that what sort of study is this one. So you will have to tell them that this is a case control study, this is a cohort, and this is some experimental study, or this is observational study. What is retrospective, what is prospective. These are very easy marks. Once you have a good concept, you should be able to answer all sorts of questions. Okay? So then you should know that what are the principles of uh, research and teaching, and what are the legal issues around them. So here, many things they will come into action, like how you are going to take consent from the patient, and if you are going to use fetal remains, then you need to take consent. What are you going to do? Okay. Then you should know about the NICE guidelines, that how you are going to keep your patient safe. Apparently, it seems difficult, but trust me, it's not. Then the third module, like core surgical care. So what is expected here? You can imagine that what do they expect from you. Like this is the core surgical care, then you should have good medical knowledge, clinical skills, you should observe professional values, and you should provide high quality patient safety care, because you are going to work as an independent specialist. Then what is your role in patient safety? So again, here many things. What are the surgical procedures? What are the important issues which surround the surgical procedures? Who will consent for the children, very important area. And what will you do if there are adults with some mental incapacity? and then adults and the children in emergency situation where they are like they're not conscious. So who is going to consent for them, and what you can do and what are your limitations. Then you should know about the name and mode of use of common surgical instruments and sutures. You'll be, it is interesting if you have done taken this exam before, that when you are doing EMQs, sometimes they will simply show you some instruments, okay? And they will not mention anything about them, like what they are, why they are used. Sometimes they will ask you to identify their names. So you can see that if you have answered 3 questions correctly, then straight away you are getting like 7.5 points, which is a lot. Sometimes it will be double step, 2-step question. They will show you the instrument and then they will ask you, they will not ask you the name. They will ask you that what is the purpose of using this instrument. So you will like, for instance, if they have shown you a Babcock. So first, in the first step, you have to identify that what is a Babcock, which instrument is this one. Then you should know when are you going to use it. So as you know that when you need to handle the soft tissue, then you are going to use Babcock. Like if you have to hold the fallopian tubes, or when you're trying to hold the gut or the vascular pedicles where you need to avoid the compression, so then you are going to use Babcock. So 2-step questions. And you have to be good. You don't have to read each and everything. More important that what you are going to read and how you are going to read, okay? And then you should be ready for the exam. So that is one thing. Then you should know about the sutures. We will tell you about all of these things during the course, okay? Then what are the complications of surgery, regional anatomy and histology? Why this is important? Because you should not damage any viscera, and you should be very careful. Then you should know your limits. And then why histology is important? Because whenever you are taking out anything from the body, you need to send that for histopathological examination. First purpose is to find that what exactly is happening to your patient for the accurate diagnosis. Second option is secondly, it is very important for your safety, because the patient should know that you have taken out only the tissue for which he consented. And if you will remove anything in addition to the one for which the patient has consented, then that's a crime. That's a federal crime, okay? That is assault and battery. Only exception will be if your patient has some life-threatening problem, like there is a cyst which is bleeding, there is an ectopic pregnancy which is bleeding, or some other complication is there, like there is necrotic tissue, and if you won't remove, your patient will go into septic shock. So that depends upon your split second decision making. But then once your patient is out of anesthesia, she is stable, then you need to inform her. So what I mean to say is that you can do only as a life-saving intervention, nothing more than that. Okay. And then you should know about the commonly faced infections, because once you are getting this doing these surgeries, then patients, they are at a slightly increased risk of developing infections. Then what are the principles of enhanced recovery programs? That is getting more and more importance. Then what is the patient safety? Okay, how you are going to control the infections? Which infections are reportable? What are the principles of preoperative, intraoperative, and postoperative care? Then principles of nutrition and water, they are very important. Electrolytes, acid-base balance, cell biology. You should be able to broadly identify that your patient is having acidosis, amphosis, and if she is having a, what sort of problem she is having. And then you know that many conditions which are seen in the post-op period, they are simply because of the electrolyte imbalance. Can you give me any example of this thing? What can be there because of the electrolyte imbalance? Sluggish bowel movements, if there is hypokalemia, right? So we need to see that what is the level of electrolytes in the body, because both hypo levels of electrolytes and hyper, they are going to cause many problems. So you know
Hyperemesis.
about them. Yeah, if your patient has hyponatremia and you are rapidly correcting it, then you know that your patient can develop a clinical condition. What do we call that? Okay, think about it.
Hyponatremia.
She had hyponatremia. You rapidly corrected that, and now your patient has developed another condition, pontine myelinosis, right? So we need to avoid rapid correction. So then they will ask you that what sort of fluid you are going to give, crystallide, colloids, or what. So these are the things. And then you should know about the use of blood and the blood products. What are you going to use? And what is the biggest hazard of blood transfusion? The greatest one, which is going to endanger your patient. Can you tell me about that?
Acute lung injury, ma'am.
Can be, but what is the biggest fear whenever you are going to transfuse?
Infection. Infection.
You know, number one, that wrong blood transfusion. The blood group was not matched. That still remains the number one hazard of blood transfusion. Like the blood you are giving, it is not properly matched. Then transmission of infection, anaphylactic reaction, and we can transmit prions. Then what are the ethics of patients? Is she going to accept? Is she Jehovah's Witness? Because in that patient, if you are, I understand that people who are Jehovah's Witness, their number is very low, but still you can see them in practice. Then how you can do this primary prevention, like avoid any anemia in them. Then how you can build up their hemoglobin level, and then if they are refusing to get blood, how you can help them. So you should know about the other vasopressors and stuff like that. Okay? So everything, you cannot just go and read one guideline and then say that this is what is written in the guideline on the blood transfusion, so I'm going to stick to that. So you have to be flexible and you have to be good. You have to think actively. This is called critical thinking. What am I doing? What will happen if I will not do offer this intervention? Then always you have to maintain a balance between the benefits and the risks. So you are actively thinking. That is the point. Okay. Then what are the general pathological principles? So whenever you are giving any blood, NTD should come to your mind. What is the blood group of my patient? Do I need to give her NTD? One thing should be linked to another one. That is the purpose of course, like you people, those who have attended my classes must have seen that I'm always giving cross references and I'm always asking you guys because the notes are already on the website. You will go, you will read them, and you will listen to the these audios, videos, everything which is on the web page. But if you are coming to the course, then you are actively dealing with your mentor, with me or other course members. And then we are not asking you questions just for the sake of it, because we are asking you questions and we are asking you questions across many modules to develop your critical thinking and reasoning skill, because without that you should not expect that you can answer the EMQs. Okay, then enhanced recovery principles. You're always getting like 2 or 3 questions from here in the SBAs and also in the EMQs. Then what information you should give to your patient and how you can prevent post-operative morbidity. Post-operative rehabilitation is very important. How you can improve your patient's experience, what are the legal issues around it, the tissues, consent of the minors. Again, you can see that cross references, prevention and complications of surgeries, like you should need to give VT prophylaxis, antibiotics, primary and secondary hemorrhage. You should be knowing about that. That is very, very important. And you should know that, here I have included this one also. Here is a full list of everything you need to know about the core surgical care. And we are going to stick with this one, okay? What is the importance of the news chart? How to write the operation notes? What is the post-op care? Do we need to place thromboprophylaxis? What is FAR and Jehovah's Witness? Lots and lots of stuff. Acute complications, intraoperative complications, post-op complications, complaints, histopathological examinations, toxins, nutrition, knowledge of the NHS system, that what you should do, And again, I would say that very important to know about the sutures and the instruments. And people think that that is just part of the part 3. No, that is part of your knowledge also. Then the fourth main knowledge area is post-operative care. So again, how you're going to provide high knowledge of care. It means that you have to be careful about all aspects of post-operative care. Actually, the point is that knowledge area 3 and 4, they broadly overlap. One is about third one is about the core surgical care, and the fourth area is about the post-op care. So you should be very good in them. Immediate complications, short-term, long-term effects, and how you should be able to assess post-operative patient. They will show you just one news chart, or they will give you just one observation, and then they will ask you that what exactly is happening to your patient. So you should know that if you get one red line or one pink line, what does it mean? If you get two yellow lines, what it means, and then after how much time you need to call the senior, and then when you are going to help them, how you are going to pick up the points. Sometimes you get students who will have no clue at all that having one red pink line means that when you should get her reviewed by a senior or consultant or what, and how you should communicate the findings. Okay. Then the diagnosis, what exactly has happened. Common, you should know about common post-operative problems. These problems can be benign, like you're always expecting them. Then, like patient will complain of pain, how you're going to cover her analgesic requirements, VTE prophylaxis, antibiotics, how you're going to see the function of bladder, bowel, and then you should understand all aspects of surgery, complications, and you will talk about something only if you know that this complication is going to happen. Then again, you should know about the NHS improvement program, which is enhanced recovery program, very important for you. Fluid electrolyte balance, surgical complications, wound healing. Sometimes they will ask you that the patient has developed, she has developed keloid formation. Okay, so where is the fault? Okay, then sometimes they will tell you that patient has wound gaping. So and then patient refused to have pre-suturing. So how this wound is going to heal? So you should know that this is by secondary intention. Then you should know that what sort of collagen tissue is seen in the scar tissue, because 9% of your questions are going to be on basic sciences. Okay, so you should be aware of the main things like that. Then you should know about the late complications, like patient can develop a secondary hemorrhage like that. So secondary hemorrhage, it is not only related to PPH. It can occur even after surgical procedures. They will give you like very vague pictures, like patient has undergone this vaginal hysterectomy, and now she is oozing brownish discharge. So nothing else is given there. So you have to see that brownish discharge is there. Is my patient having spikes of fever or what? So you need to look at the news findings. Okay, they will show you a chart or they will just give you the description. So basically you have to be very careful. If you don't remember that there can be vault hematoma, and brownish discharge means that something else is there. So you will have to think that this is infection, this is hematoma, this is local atrophy, because they will give you someone who is postmenopausal and having these problems. So then you will have to look at the background and give the best possible answer. And then I will tell you about the techniques, that how you're going to answer the SBAs and the EMQs. So the next area is antenatal care. So here you should know that how you're going to provide care. Like you should know about the normal antenatal processes, progress, and you should be able to recognize and manage problems of preconception issues, and from preconceptual area to the delivery. More so important if your patient has some underlying medical disorders. And then even for the normal patient, you should know that what is normal, because if you want to find the abnormal, you should know about the normal. Then you should be conversant with the principles of prenatal diagnosis and screening. Which screening method at what time, which one is the best method, which one is going to yield the highest results. So all of this information is very dynamic, very important, and this is a developing field, so you have to keep yourself fresh with the updates in the field. So then you should know that what problems a fetus can have, and how you should interpret, and how you should do select the appropriate investigation, and then you have done an investigation, you have obtained the result, how you are going to act on that investigation, that result, how you are going to interpret. You are not just leaving the patient there, how you are going to improve patient's health. Then you should know about the use of ultrasound, investigations, treatment of the disorders of the fetus. I know that many of the students, they are confused that sometimes we have no idea that what exactly is happening to the patient, so how we can investigate. Okay, we understand that in practice there can be problems, but in theory, yes, sky is the limit. You can do a lot of things. So what topics here, like in addition to the routine topics, you should know about domestic violence, teenage pregnancy, drugs, alcohols, normal pregnancy, birth, perpenium, because you need to give her information. Know about the placental disorders and other abnormalities, like what is battle load placenta, what is velamentous card insertion. Okay, then you should know about the common genetic conditions and the importance of screening and diagnosis, because in the UK healthcare system, and now even in the Irish system, you have the option to offer termination of pregnancy. When, how, who, all W and H questions. Okay, know about the epidemiology, etiology, pathogenesis, diagnosis, prevention, management, complications of delivery, and like pregnancy-induced hypertension, antepartum hemorrhage, preterm labor, multiple pregnancy, malpresentation, PPROM, SROM, fetal growth restriction, fetal hemolysis, prolonged labor, congenital malformations, then how the social and the complex social factors, you can see here that how do they affect the maternal health, and what are the other problems. Know about the immunology and immunological disorders of pregnancy, then preconception care in certain conditions. What are the principles of inheritance? What are the teratogens? What are the drugs? And what are their effects on pregnancy? Then where you should carry out this antenatal care. Okay. When are you going to screen them for the abnormalities? When are you going to call another specialty person? When are you going to involve fetal medicine? What is this Rh factor? What are other immunizations? What are other disorders? In PPROM, PPROM is not just one thing. You should know about fetal pulmonary maturity, what therapy should be given. So you are going to give a combination of steroids, antibiotics, prophylactics, and do we need to give her magnesium sulfate or not? Then what is the biggest risk of preterm PPROM? Like your patient can get infection, so risk management, identification, care, then delivery, where you should do that, at what time you should do that, and do we need to induce the labor? Do we need to deliver her surgically? All of these decision making is part of this module. Hemorrhage, know about the placental abruption, placenta previa, vasa previa, placenta eclita, then know about the normal, this physiology of pregnancy and management, like pregnancy, childbirth. Okay, if she's delivering outside specialist unit, perperium, lactation, because you need to give information to your patient on all of these things. What is the malpresentation and when you should take action. So they can be like this is also a very lengthy module. Okay, you need to see that what are you doing and how you are going to improve the overall health of your patient. And here the biggest challenge is that people they will think that they need to talk about the maternal issues also, but that is not the point. You need to address the fetal issues also. Okay, know about the breech, brow, face, shoulder, and then variable lie. Like then sometimes the fetal head is very high. Know about the antepartum, intrapartum problems, and what is the safe place for the delivery. No, it's a very lengthy module. What are different diagnostic modalities, how you can use them, how you can assess fetal growth, what will happen if the patient is having mid-trimester miscarriage or she's having preterm birth, pregnancy-induced hypertension, fetal hemolysis, then prolonged pregnancy. That is also part of the antenatal care. What is the epidemiology of prolonged pregnancy, etiology, pathogenesis, diagnosis, prevention, management, delivery, complications, prognosis, risk, fetal monitoring, delivery. One thing is not going to answer all questions. Prolonged pregnancy is also important part of your daily practice. Post maturity, like here you can see. So you need to address all the issues around it. Then multiple pregnancy, you should know that what are the specific challenges of multiple pregnancy, how you can minimize the complications for the mother and the baby. Then if you have diagnosed some congenital abnormalities, more as you know, more common in the twin pregnancy. But even if in the singleton pregnancy you have diagnosed some problems, then what should be your action? When are you going to refer? When are you going to find the cause? Who should be involved? So again, plenty of things. Fetal hydropsis there. What are the causes? What are then 101 things are there. Then what are the social and the cultural factors? What is the etiology? Like what can happen? How you can prevent them? Then you can come across same-sex couples, same-sex parents, then single parent, what complications you can have, teenage parent, then someone has met this, unfortunately, this IUFD, what should be the part of your bereavement counseling, then teenage motherhood, very important, then what factors are going to interfere or promote parental and the parent-baby relationship. Then if then again very important area, female genital mutilation, that how you're going to talk sensitively. And if you have seen someone having this FGM, then how you're going to document, or you're going to get 3 MQs from just this one topic, FGM. Then know about the invasive procedures, their timings, how to do them, what are the risks, how to consent your patient about them. So you can see that all of this information is very important. Then the next area is maternal medicine. Of course, this is I think, the lengthiest of the modules. You should have good understanding of common medical disorders that will affect the pregnancy and how the pregnancy will affect them. Then you should know that you can understand these conditions and you can liaise with the other colleagues and the specialists. Okay. So know about the etiology of the diseases, what are the chronic diseases, how you're going to collaborate with other specialties, what is multidisciplinary team, who should be on your team, and it includes virtually all systems of the body. Then what will be the effect on the mother if some organ is involved? What will be the effect on the baby? Diagnosis, which drugs are safe, when are you going to start, when are you going to stop? Transplantation, everything, like the kidney patients are there. Understand that is heart disease is very important. Then understand liver disorders, then the circulatory disorders, then thromboembolism, VT, everything will be into the circulatory system. What are varicose veins? Do you need to start something for it? What is thrombocytopenia? What are thrombophilias? Then you should pulmonary diseases. These are also very important. They're always asking questions on asthma, infections, embolism, aspiration syndromes. Then you should know about a lot. You need to know a lot about neurological conditions. What are important conditions? Which is the most important neurological condition in pregnancy? What do you think? Epilepsy, right? Epilepsy, cerebrovascular accidents, then multiple sclerosis, migraine, neuropathies, myasthenia gravis, paraplegia, headache. Okay, then you should know about the musculoskeletal system. What problems your patient can have? Is the pregnancy playing any role? Then psychiatric disorders are very important. You know that we have a very big PDF, lengthy PDF on the mental disorders, right? If you had the opportunity to go through that, it is available on your web page. So you should know about manic depressive disorders, psychoneurosis, then peripheral disorders like the baby blues, depression, mood disorders, schizophrenia, reaction to pregnancy loss. All of these things are important. Then you should know about inherited disorders like hemoglobinopathies, anemia, sickle cell disease, thalassemia. Know about connective tissue disorders. Endocrine disorders are very important. So, what is the most common endocrine disorder of pregnancy? Will you share with me? Diabetes, right? And the second most common disorder is going to be thyroid disorder. So regarding the diabetes, you should know about type 1, type 2, what is ketoacidosis, what are the drugs, how do we administer them, what are the effects on the baby and the mother. Large for gestational age babies like that, how to deliver them. Then know about the gastrointestinal disorders, what is IBD. We will start with the simple nausea, vomiting of pregnancy, hyperemesis, appendicitis, very important topic. You are always getting questions from here, intestinal obstruction. Then what are the neoplasia of the pregnancy, how you are going to manage them, like the breast cancer. Then other malignancies, you should know that when you are going to continue the pregnancy, when you should terminate the pregnancy. Then endocrinopathies, thyroid is also very important. Adrenal diseases are very important. Congenital adrenal hyperplasia is important. How you will manage that? Pituitary problems are common. They can occur. So know about the hyperprolactinemia outside pregnancy, how it is affecting women's health, and then you should know that how what changes will occur during pregnancy, how you need to address them. Then you should know about the infections. These infections, these can be like simple infections, like the patient has sore throat, or then there can be infections which are related to the pregnancy. So again, you should know about pyrexia, immunizations, which serological test you will do. Do you need to give them antibiotics? Do you need to give them antiviral therapies? What is sepsis? What is preterm labor? Why it is happening? What is chorioamnionitis? Then you should know a lot about UTIs, wound infections, septic shock, malaria, tropical infections, and then you should know about the fetus and the neonate, like the streptococci, gonococci, syphilis, toxo, listeria, H. influenzae, chlamydia, mycoplasma, ureaplasma. These things, as if you have seen the latest version of the guideline on PID, BASH guideline, you should know that Mycoplasma hominis, its incidence is rising, and now about 1/3 of the patients they are positive for Mycoplasma. Which antibiotic should be given? Rubella, CMV, Hepa A, B, C, and Hepa E, common flu, and now this coronavirus, neonatal sepsis, and you should understand other maternal complications due to pregnancy. What will happen to the mother if there is APH, if there is amniotic fluid embolism? What is Sheehan syndrome? So you can see that this is a very huge module. That is the point. Okay? So in addition to these things, like the next module, management of labor, many things can be there. You should know about the labor ward prioritization, how you will manage malpresentations, what is fetal blood sampling, what will you do if there is occipito-posterior position, IUGR, macrosomia, what is normal CTG, what is abnormal CTG, what is induction of labor, how you can offer that, then perinatal mental health, all of these things are important. So you should know about physiology, biochemistry, endocrinology of parturition, including maturation of the fetal endocrine system, different pathways, when you should give this glucolysis, where it is contraindicated, and when you should give something to increase uterine contraction, to stimulate it. Know about the fetal physiology in late pregnancy, how you will assess the fetus during labor. All of these things are important for you. Okay? You should know about the image that when the labor is starting. You should know about the principles of intrapartum care and understanding of normal and abnormal labor. Then how you will interpret the lab results, clinical judgment, prioritization, how you will manage as a team. Then what are the communication skills? Like there is cord prolapse. So what should be your first step? There is cord prolapse, so there is shoulder dystocia. So what is the first step in management? Call for help, right? Then pay attention to the emotional condition of mother, cultural awareness, then what is the importance of using, you know, blood products. What should be the fluid balance in labor? Like if your patient has renal disease or if she has like this cardiac problem, what you should do, how you should see the myometrial activity. You should know about induction of labor, management of labor, augmentation of labor. Know the normal labor and delivery. What are the, this regional anesthesia, analgesia, sedation. How you will assess fetal well-being and compromise. To prolonged labor, emergencies, preterm labor, PPROM, maternal collapse, hemorrhage, cervical surclash, multiple pregnancy in labor, severe preeclampsia and preeclampsia, IUFT, acute abdomen, mechanism of normal and abnormal labor. They will ask you, sometimes they will give you the stages of labor and they will ask you that what is the sequence of events. So you should be able to tell them that what is the sequence of events like that. So simple things, but should be on your fingertips. So spontaneous labor, what are the drugs? What are their actions on the myometrium, on the cervix? What is the partogram? What is the fluid balance? And then induction of labor, indications, contraindications, side effects, blood transfusion, regional anesthesia. You should know about epidural, spinal, pudendal block, indications and contraindications. Then what sort of narcotics you can give. Then you should know about the fetal compromise, like cord prolapse, intrauterine fetal death, stillbirth. All of these things should be on your fingertips. Management of prolonged labor, procedures, instrumental deliveries, use of antibiotics, steroids, tocolytics, then multiple pregnancy and labor, placental abruption, all of these things. So you can see that, you're going to see overlap in between different topics also. So you don't be confused, because whenever we are talking about these conditions, we are explaining that you should anticipate a question on labor, management of labor, antenatal care. So the clinical knowledge area 8 is management of delivery. So you are expected to know about the normal and abnormal delivery. So normal delivery, operative delivery, complex delivery, retained vaginal, retained placenta, management of female genital mutilation, then malpresentation, which can be brow, face, shoulder, unstable lie, malposition, then manual rotation of the fetal head, know about the instruments like the forceps and the ventouse, then mid-cavity forceps, ventouse, when are you going to use rotational forceps or ventouse. You should know the pelvic floor anatomy, right? Episiotomy, perineal trauma and repair, female genital mutilation, how you will carry out assisted breech delivery, what are the hazards, breech extraction, twin delivery, high order multiple birth, shoulder dystocia, cesarean section, indications, complications, routine procedures or the repeat procedures, acute emergencies, second stage cesarean sections, and then the sterilization procedures that when you can offer and when you cannot offer, general anesthetics, complications. Then if your patient is unconscious, like maternal collapse, then how you're going to resuscitate them, who should be going to the ICU, when do we need this, this ICU care. Then the ninth knowledge area is postpartum problem. Here you should know about the skills, attitudes in relation to postpartum problems, and it also covers resuscitation of both mother and the baby, birth trauma and other birth complications, and neonatal problems at birth. Like you should know about the normal, abnormal postpartum period, then how you will control PPH, then how you can use appropriate blood and the blood products, MROP, bimanual compression of the uterus, exploration of the genital tract, cervical lacerations, drug management of hemorrhage, what is balloon tamponade of the uterus, then why do we do laparotomy, when we should go for laparotomy, what is B-Lynch stitch, what is the role of interventional radiology, what is the uterine artery, this embolization. Then you should know about the ligation of the internal iliac arteries. You should know that you are going to offer this stepwise devascularization and in which order you are going to proceed. What is the cesarean hysterectomy, perineal surgery, repair of episiotomy and tears, retained placenta, postpartum complications, postnatal review, contraception, then other complications like that, cancers, then where you should refer your patient. All of these things are important. This is also a very lengthy, this area, but you need to know about them. So then also important for you to know about the neonate. Any respiratory distress, hyperbilirubinemia, infection, seizures, hypoglycemia, hypothermia, heart disease, hemorrhage, enterocolitis, preterm infant, congenital anomalies, syndrome, cerebral palsy, and the problems with the feeding. You should know about the advantages of the breastfeeding, and then you should know that where you are going to offer artificial feeding. Then the next module is on the gynecological problems. Again, many topics are covered here. Like you can see, there is a lot. So all of these conditions we have covered, and we will be covering more of them. So basically, you need to know about almost everything in this module. Okay? Acute and chronic conditions, pediatric and adolescent gynecology, behavioral changes, abuse, menstrual disorders, where you are going to offer medical treatment, where are you going to offer surgical treatments, what are fibroids, what sort of bleeding they are having intermenstrual, or what sort of problem they are having, any hormonal issues, menopause, osteoporosis, premature, this precocious puberty, everything is covered here. Chronic pelvic pain, HRT, contemporary therapies, benign vulval disease, EIDs, tubo-ovarian masses, torsion, child sexual abuse, premenstrual syndromes. Then, there can be other disorders like vulvodynia, then vulval pain, lichen sclerosis, contact dermatitis, psoriasis, number of things. Then many sorts of discharges. All of the discharges are not going to be there because of the STIs. Okay? And then you should know about benign ovarian cysts, miscarriage, ectopic pregnancy. Then if they have congenital abnormalities like ambiguous genitalia, imperforate hymen, vaginal septate, uterine anomalies, gonadal dysgenesis, Mullerian agenesis. Then what is the pathology and physiology of puberty? What are the normal problems? What is precocious puberty? What is delayed puberty? Abnormal uterine bleeding. So again, a lot has been covered. So we have summarized all of these topics. Okay, that is one of the important features of the course. Then the next module is this is clinical competency area 11, subfertility. So many topics are covered here. So you should know that you can understand the problems associated with subfertility. What is the epidemiology, etiology, pathogenesis, clinical treatment of the both male and female infertility. What investigations should be done, how you should manage them, what is endometriosis. Then you should know about the different types of, here you can see different types of infertility, how you are going to manage them, and then how you're going to keep your patient well. What are the complications of ERT? And what are the legal and ethical issues? Okay, what are the different techniques? Can you counsel your patient appropriately? Do you need to do any operative procedures? Like here, like sometimes you have to do this diagnostic laparoscopy, hysteroscopy. What are the indications, limitations, complications of various procedures like ovulation induction? What does the law say? What are the complications of IUI, surgical sperm retrieval, ICSI, when these things should be offered, who should be doing that, and do you need to refer your patient somewhere? Then what is the role of Human Fertilization and Embryology Act? Who should be informed? You should know about the indications, limitations, complications of surgery in relation to both male and female infertility. Reversal of sterilization or vasectomy, how you can remove adhesions, what is the role of salpingotomy, hysteroscopic surgeries, varicose veins. All of these things are covered here. Formerly, this sexual and reproductive health, it was covered under the subfertility, like the this module, but now this is a separate module. And we don't call them modules anymore, we call them clinical competencies in place. So here you need to see that how you are going to care for the good sexual health. Can you manage, identify STIs? Can you, and in the STIs, you're going to cover HIV also. And there is new guideline on the HIV. It was published in 2019, and the summary is available on your webpage. So you should know about the emergency contraception, regular contraception, their modes of actions, efficacy, indication, contraindications, and complications. Know about the miscarriage, what are the laws, STIs, infection, consent, and child protection. Then you should know, especially, the special areas will be those that are you paying attention to the contraceptive health of minorities or marginalized people, vulnerable people like the young people, asylum seekers, commercial sex workers, drug abusers, and prisoners. These things are gaining more importance. Then who should be screened like that? Many things are there. What sort of reversible, irreversible contraception you can offer? Child protection is very important. You should know about the Child Sexual Offences Act of 2003. Know about the human sexual response, what factors are important, and you should have some information about all family planning methods. What is persona? What are the variant methods? What are the chemical hormonal methods? Drawbacks, benefits, all of these things. Then you should consider that there are certain, like what are the failure methods, what are the failure rates, how you can prevent them, and more important, that how you can choose the best option for your patient. Then you should know the sexual disorders, how you can help your patients, like then you should know that what are the trends, what are the new developments, like that like this implanon is no longer available in the market. They removed it 6 years ago. So in the exam, you're going to get next planon, you're not going to get any implanon. So you should know about the clinical features of various disorders. Very important for you to know about the psychosexual medicine, sexual dysfunction. These are very important. What are the abnormal and the abnormal behaviors, like that. And then again, you need to know here about the infections. Like I've told you that there are overlaps between the areas, okay? So the competency area 13 is on early pregnancy care. What is your task here? You should know about the early pregnancy complications, normal early pregnancy, pregnancy loss, diagnosis, investigation, management, psychological support in miscarriage and ectopic pregnancy. And you should be able to know them medically as well as surgically. And how you are going to use ultrasound for your own health. Then the next module is going to be oncology. Again, you should know about the pre-malignant conditions and malignant conditions, their management, their diagnosis, and when are you going to involve the gynecological oncologist? Who is going to care for the woman? What are the different hereditary syndromes? Epidemiology of cancers. Basically, you should know about the breast cancer, vulva, vagina, uterus, cervix, fallopian tube, and the ovarian cancers. You should broadly know about the FIGO classification of the gynecological tumors. Very important to know about the palliative care, relief of symptoms, community support, indications and limitations in relation to screening and investigation techniques, cytology, HPV testing, and what changes have occurred in the cervical screening program. These things should be on your fingertips. Diagnostic imaging, what are the indications, complications, outcomes of oncological surgery, radiotherapy, acute complications, later complications. Then very important for you to know that which patient is going to benefit from the surgery, which patient will need radiotherapy, who will need chemotherapy, who should be on the multidisciplinary team, what is HPV vaccination. All of these things are important for you. And the last area, knowledge area, is 15, urogynecology. So you should know about the management of urinary incontinence as well as fecal incontinence. That is equally important. What are the benign bladder conditions, urogenital prolapse, pathophysiology of conditions. So basically you should know about the anatomy, physiology, pathophysiology of the pelvic floor, urinary tract, common problems right from infection to the prolapse. What are the investigations which should be done? What are their limitations? Then you should know about the urodynamics. You should know about the video cystourethropy, urethroskopy, imaging, complications, indications, techniques, limitations, complications of non-surgical treatments. What is the role of pads and the garments? Bladder retraining, how do we do that? What is pelvic floor exercise? How do we offer them? What is self-catheterization? Who should be doing it? And you should know that what are the postpartum voiding problems? What are the principles of catheter insertion and removal, community care? So know about the drugs, like which drugs are important: anticholinergic, antimuscarinic, alpha blockers, antidepressants, estrogens, indications for use, then when you should offer the tape procedures, when we have to offer hysterectomy, which sort of hysterectomy should be done, if there is wall prolapse, what should be done. So you can see a lot of things out there. So you should be able to understand the indications of imaging also. When you will do, why you will do. So all of this information seems a lot, right? Any questions so far?
No,
So yeah, please go on. Okay,
no, it's okay. Perfect.
okay, that's fine. So in addition to doing the green top guidelines, like we are going to give you summaries of all important topic, important some guidelines, nice guidelines, scientific impact papers, and then I see many students who will take exam without ever reading the talks. In the talks, you need to cover talks for the last 3 years. And if you have seen the Ariz website, you must have seen that we have summarized all issues. And like on average, in one talk, 1 year's talk, there are like 300 pages, right? But we are summarizing them for you, and you will get like how many? Like you will get just like 50 pages. Okay? So sometimes the people will say that you should do the talks for the last 5 years. The 5 years are too much. So there are some important talks like which you have to cover, like asthma in pregnancy, teenage pregnancy, analgesia, but now there is one SIP on the analgesia during labor, so you don't have to worry about that. So we just try to give you like summaries, and we will provide you summaries for the last 3 years. Then the green top guidelines, there is a specific way of doing them. So as you will go through the course, we are going to tell you that how we should do them. So you can see that passing the exam is difficult, but it is not impossible. There is a way of reading the talk articles. Many people say that you should go to the CPD questions and then try to answer them when you're fine to go. This is not the case, okay? You need to go to the topic which is covered in the talk, look at the main information. At least once you should read that, look at the tables, and then you're good to go. So regarding the EMQs and SPAs, you should know that what is the part. SPAs, they will account for 40% of your score, and the EMQs, they will account for 60% of your score. Okay? So don't miss any question. Go in a sequence. If you're not sure about your answer, still write down the answer. Make a faint line. And once you are done, then you have finished all the questions. Don't miss any questions, and always match the question number with the number of the answer on the answer sheet. Okay? Because if you don't do that and you make one mistake, then throughout your paper you are going to make a mistake. That is the point. So regarding the SBAs, RCUG introduced these SBAs from March 2015. So you should practice as much as you can. There are many wonderful books, but I would say that nowadays the strategy is free, so that is the best source for taking that, having a look at the SPS, because that is directly coming from the RCOG. practice the questions, and then you should pay respect to this one. People think that this is easy, but doesn't matter. Even if it is easy, it is going to increase your score. So you have to practice, and then you have to overcome your anxiety. Okay? Sometimes what happens is that in the SPAs, you are looking for a certain specific answer, but it is not given there. So in that case, you will go for the next best option. Okay? So for each paper, like you have two papers, so you are going to get two sheets where you will, the sheet will be numbered 1 to 50. And against each number, there are 5 lozenges which are labeled A to E. So each question in the question booklet, it consists of a lead-in statement which tells you clearly what to do. Then you will get a list of 5 options labeled A to E to match the answer sheet. And the options, they are almost always given in the alphabetical order, so you should not be worried about them. And when you look at the question, you will see that there are several possible options, but you must choose the one that is most likely, the one most likely from the list of the options. You have to choose the one option. So if you don't get so you have read a question, then you should think about the answer, okay? And then look for that option into the options given. If it is not given, then you should go to the next best option. Then you should know that most of the options will be correct. Just one will be totally incorrect. So again, go back to your question, because one option is going to be the most relevant to your given scenario. Like here we have like many questions. Some questions will be very simple. Like a woman who is Rh negative undergoes amniocentesis at 16 weeks. So what dose of anti-D immunoglobulin should be given to her immediately after the procedure? So this is simple. Like this is less than 20 weeks, so you're going to give her 250 international units. Okay, let's go to the next one. You have just examined a 28-year-old primary gravida in spontaneous labor. Examination findings are 0 by 5 palpable per abdomen. Cervix is 7 centimeter dilated. Cephalic presentation, -1 station. Anterior fontanelle palpable per orbital ridges, and nasal bridge felt anteriorly. So what is the presenting diameter of the fetus? So what do you think? The options are mentovertical, occipitofrontal, submentobrachmatic, suboccipitobregmatic, and suboccipitofrontal. So what do you think? Which option, which presentation is this one? So what do you think? What exactly are you feeling here?
And
This is the largest diameter, right?
like orbital ridges and nasal ridge. Mentovertical.
Yes, that's mentovertical. So you're going to get like simple. Uh, Here you're just going to recall the knowledge, okay? But sometimes you will have to interpret. But usually the SPs, they are going to be straightforward like that. Let's go to the next one. A 21-year-old woman who is known to have beta thalassemia major attends the clinic for preconception counseling. So what is the most relevant initial pre-pregnancy investigation to predict maternal complications of pregnancy? Beta thalassemia major. So she is a known case. She is 21, right? So which sort of assessment should be done for her? Like you would like to do cardiac MRI, you would like to do the chest X-ray, ECG, echocardiogram, or pulmonary function test. So what do you think? Which one is most important?
It's basically echo. There is some other name about the heart.
So why you would like to do echocardiogram? To see the
Because
functional status of the patient, right? And how
yeah,
much she's doing. Okay. This cardiac MRI, yes, it can be done, but the first they are asking you about the basic one.
T3 echo and
Yeah, that is going to be this one, to see that what is the functional level, what is the ejection fraction of the heart, can she sustain the the stress of pregnancy, or she cannot. That's why you have to think logically. While if you will look at that, we need to do all of these things, right? Okay? PFT we are not offering, but we are offering the liver tests also. Liver function test, liver iron scan, ferry scan, remember the stuff like that. Okay. The next question is that a 34-year-old woman attends for her booking in her third pregnancy and she had a cesarean section in her first pregnancy 4 years ago and has had a successful vaginal birth after cesarean section 2 years ago. She had a VBAC and now she has a BMI of 26. So what is the best predictor for a successful VBAC? Like
Previous
the
vaginal,
yeah,
previous vaginal.
yes, it's very clear. Previous vaginal birth. So sometimes you will get if you look at them, all of these things except this D, these are helpful. They are going to tell you that patient is going to be fine. But this is the biggest or the strongest predictor, the best predictor of successful VBAC like that. So the next question is like, these are just examples. Let's do this fifth one. You are asked to see a 21-year-old woman for preconceptual care. She was diagnosed with generalized chronic epilepsy 4 years ago, and this is poorly controlled, and she is currently on sodium valproate and levetiracetam. So what is the next step in her management? So look at the options. She is here for the preconceptual care.
Folic acid.
Yeah,
Folic
that
acid.
is correct. That we should start folic acid and 5 mg because we want to protect her from developing neural tube defect. That is the problem. Okay. Now let's see that if we can do. Yeah, here the correct answer was cardiac echogram. And then you can get like many simple questions, many complicated questions. So you are going to get lots and lots of questions when you will go to the Ariz website because you must have seen that there are many, and then you will have the SPs in the gynae also. Like for example, let's go over a couple of them. Okay. Okay, that you have been asked to obtain consent from a 32-year-old woman with a cyclical pelvic pain for a diagnostic hysteroscopy under GA. So what would you advise her regarding the overall risk of a serious complication? So it is 1 in 50, 1 in 100, 1 in 250, 1 in 500, or 1 in 1000. Risk of serious complication. Okay.
E.
Like that. So here sometimes you will need to remember just the factual options, okay? Just the factual things. So then the next question is 28-year-old woman undergoes extensive laparoscopic surgery in the lithotomy position. She presents after 2 days with unresolved right-sided foot drop and paresthesia over the calf and the dorsum of the right foot. So damage to which nerve is more likely to have
Common parole.
foot drop? So this is common peroneal. So that's how you can get this very simple SPAs or you can get the complicated ones. It depends on your luck also, but all of these things they are going to be fine. Like if you know the way, you should be able to answer them. Most of this, but all SPAs they will not be straightforward. Sometimes you will have to go to the second step and then interpret them. But with practice, you can do that. So then the second type of questions are going to be the EMQs. Each EMQ is going to have different parts. Like EMQ, you can have like, again, you will get the papers, 2 papers, and the numbers will be like 1 to 50 and lozenges, and there can be like up to 20 options can be there, okay? So each question in the question booklet, it will have one option list. That is the one part. It will tell you that what is happening. The list is there. Then there will be one lead-in statement. And then we will have a list of 1 to 5 questions. So 3 parts in each EMQ. An answer sheet can be like 20 possible options, but mostly they will have like 10 to 14 answers. So each correct answer, it will get 1 mark, and wrong answers, they're not penalized. And if you may have marked 2 or more lozenges, then they will cancel each other. So with in the example options, questions like you can have multiple options, and then you will have to see in the real exam you will have even more options like that. And some of the questions they will not have any relevant options like that. Okay. So what you have to do, well, like they will give you the list of options, then they will give you the instructions. Okay. So this is the list of options. Okay. So then what are they giving you? You can see here. Don't have to go over this one. Okay. And the technique of doing the EMQs is that think about them that they are giving you a full scenario. Then see that which information is missing and what they are exactly asking, and then you have to decide what. So don't look at the options at all. What you can do here is that go over the question. They will always give you this standard information that each option may be used once, more than once, or not at all. Like there is a previously healthy 18-year-old primary gravida presents at 36 weeks, feeling unwell and tired. Her mother died unexpectedly, aged 90. Her chest X-ray showed an enlarged heart. While being admitted, she developed increasingly shortness of breath and died despite intensive resuscitation. So, what is the likely diagnosis? So, her this is the only
Cardiomyopathy.
clue. Yeah, hypertrophic obstructive cardiomyopathy. So cardiomyopathy is the answer here. So, even without looking at the options, you have to guess, make a guess based on your information, and then that would be your answer. So first find an answer and then look for that option into the question. So that is cardiomyopathy. Then second question also related to the same thing. Like 30-year-old woman, 28 weeks of gestation in her sixth pregnancy, presents to A&E department with breathlessness, displays severe anxiety, and she had complained of left-sided pelvic pain for a week. While being assessed, she collapsed and it was not possible to resuscitate her. So first, she had left-sided pelvic pain for 1 week. So what comes to your mind? What was that? So this one, what do you get? She's 28, she's grand multi, breathlessness, and severe anxiety. And she collapsed, but she had this left-sided pelvic pain for a week.
DVT.
So yeah, DVT was there because she developed left-sided, but now breathlessness and severe anxiety. Pulmonary embolism, right? Sixth pregnancy. DVT was there. What is the difference between DVT and embolism? DVT when the clot has formed, and then when it has gone to the pulmonary, it has
After the
detached itself
discharge.
and gone to somewhere else, then we will call that embolism. Cannot be amniotic fluid embolism because there is nothing like the labor and stuff like that. So we will go with the pulmonary embolism. That would be the answer. So I mean that is that sort of questions you are going to get in the exam. Now again going back to the exam resources, the NICE guidelines. So many NICE guidelines are there like ANC, cesarean section, diabetes, domestic violence, ectopic pregnancy and miscarriage, fertility, onset fertility, then having abnormal uterine bleeding, hypertension, induction of labor, intrapartum care, then intrapartum care for women with existing medical disorders, postnatal care, antenatal and perinatal postnatal mental health, now they call it perinatal mental health, preterm labor and birth, LARC, twin and triplet pregnancies, pregnancy and social complex social issues, prevention and treatment of surgical site infection, urinary incontinence and pelvic organ prolapse, menopause, ovarian cancer. So at least these guidelines you need to do. And then we top guidelines, you know already that there are a lot of guidelines. Many guidelines are there like this. Then regarding the SF talks, I have told you that we are going to do talks for 3 years and you are going to get the summary, so it should not be a difficult task. That is the point. Some topics we have to do from other journals like OGRM also like that. We'll do them. So once you pass the exam, you can say that you have become person of the year. Why? Because you know that is an real task. Okay? So you can see that how you have passed the exam. So here again, I will just tell you briefly about the courses that what are you going to get. So those who have attended the course, you should know that you have got, we do interactive sessions, you will get the online lectures, then you can get the lecture PDF, and for each group we are making the new page and we are giving you the new lessons, and every single day you can go there and you can read them as many times as you like. Then there are pre-test quizzes and mock exams, and most of you, like when you started your course, you must have taken one pre-test if you remember, because it will give us the baseline information that what you are going to do and how we should make your plan. So you are going to get individualized plans. Then the Q bank. We have more than 400 EMQs and more than 800 SPAs. Then there are different courses like the 6 months course. This is made for those people who are going to sit the exam in 2021 Jan. So you can see the features like this is a comprehensive course, weekly classes, initially once weekly, then twice weekly. And then 1 month before exam, you are going to have daily classes like that. And 1 week before exam, maybe 7-8 hours a day. So module-wise teaching, we are following the all knowledge areas. We are doing mock exams, pre-test, quizzes, and then you are going to get free MCQ bank here, question bank here. Otherwise, you have to pay like $100 per month. So here you are going to get it free as a complement with the long course, and the fees you can see here. Then for the 3 months regular course, you all know that it has many features like comprehensive course. We are giving weekly classes. You're getting access to the recorded sessions, module-wide teaching, pre-test, quizzes, mock exams, and it costs like 600. And anyone who will go for the crash course, which is for the 4 weeks, then they are going to get a discount also. Then 4-week crash course, it is also comprehensive, twice or 3 times weekly classes, and they will have access to recorded sessions. Then again, all knowledge areas are covered, pre-test, quizzes, QBank, everything is there, and it costs like 450. And then 3-day revision course, we are going to do basically here the case-based learning, different strategies to answer the questions, how to improve the score, what should be read and what should be left, and 8 hourly daily classes, and rapid revision of the key concepts. So this is for the fast rapid revision, and this is offered in the 6-month long course also. And these guys, they are going to get 10-day access to the QBank, and it is going to cost like $325. And if you think that you are repeating the exam, you have good information, you don't need to take the full course, then you can go and you can just go take the QBank. Many people, they like to have the QBank only, so it costs like $100 per month. So here I can show you some testimonials you can read for yourself. Like many people from many courses, they come back to us. Why? Because they want to know the logics, that why some answer is correct, what is the right technique, because having the knowledge is not enough. You should know that how you are going to answer the questions and what are the important parts. So we get such compliments all the time that we attended this one and that one course, and we had this problem. These are wonderful courses, everything is best, but mostly they will come back to us for getting the correct answers. Basically, getting correct answers is just one thing. You should know why one answer is correct and why other answers are wrong. And me and other mentors with us, they give you extensive practice. And just having the knowledge is not enough. You should be able to apply your knowledge. That is more important. Then we get all sorts of things. Mostly the people they will come to us for like part 2 courses, then they will come back for the part 2, and then at the same time they will ask for the part 3 course like that. So we get all of these things. And regarding the students, we get from the Portugal, from the Ireland, from the UKs, from West Indies, even from the USA, because they are also sometimes the people they like to take this qualification because their MRCOG is a very prestigious degree. Then we get the students from Hong Kong, Singapore, China, Malaysia, Indonesia, Myanmar, and of course from Pakistan and India we get many people. So that's how, just reassuring, because if you will see that other people have also passed, so it will raise your hopes also. Okay. So you get there like this, and they will sometimes the students they will share their scores also with us. So that's how it is. And then you can see here also This one was also a writer, came from USA, and he was already a consultant. But even the consultants, they will fail the exam sometimes if they don't have good knowledge. This guy, Juan Siraj, brilliant guy, but he came to us because he wanted to. He tried first, but then he came back to us like that. So they will come back to us for the part 3 also. Then these people, students, they show their love, they show their trust like that. So personally, I don't like to take anyone's name or anything, but like you can see here, like here is a list of some names who came to us like in the last year, and they did many courses like part 2, part 3. Some of them they did part 1, part 2, and then they came like that. So you know about our contact, that you can go to the website or you can just drop a message on the WhatsApp. So here are the numbers for you. Okay. So anyone likes to contact, likes to get more information on the courses, how do they work? So you can always contact us. Then I'd like to say thank you for coming and attending this session with me. And now I would like to take your questions if you have any. Any question you have, please ask me.
Onboarding.
Okay, that's great. So anything occurs to you, you want to know about something, you are most welcome to ask us. And for those like who are already attending course, their plan is, or we are preparing their plan because we want you to have the maximum benefit. And that's why, we are making your plan, and within a couple of days, you will get it. And what is the benefit? Like, the point is that you should get your plan. You should know that what are you going to do, and we are going to give you the homeworks and the stuff also, because we have to monitor that how you are doing, what is your progress, and how you are going to benefit from it. So you're going to get regular homeworks, study plan will be there like that. Like I will show you like one plan. This is like something like that. I'm not showing here that what exactly are you going to see, but that's how we make our plans. Like you can see here that people who are coming to us, they're going to get these schedules. Like this is just an example that what are the main emphasis on these topics, and then every week we are going to cover. This is the second batch. First batch was for the Feb exam, who came for the crash course. So you can see that here will be the live lecture, then the topic test every 5, and then every single day I'm going to tell you that what are you going to do, and you are going to get your own progress page also, where you will have to write that what have you done every single day. This is not to punish anyone, but this is just to give you good practice like that. For all Ariz exam courses, you are going to get a schedule like this. So that's how we track your progress. And in the end, I will say that if you come and join our course, which is going to be very productive, we are not using old lectures. We are giving you new lectures. We are answering your questions. We are making personalized plans. And then we are giving you the best tips according to your circumstances. Like we are asking the student that how many hours a week they can spend on the studies, and then on the basis of their circumstances, we are making their courses. Because in the exam, sometimes the students they will fail because of the academic problems, and sometimes they will fail due to non-academic problems. So we try to address them, because the purpose of this group activity is to improve your chances of passing the exam. That is the point. So if you have any other information, then please ask me, and then we will see you in the class. Okay, take care. Thank you very much. Bye bye. I wish you all the best on behalf of Ariz team. Just take care.